Hi, my name is Jeff Walden, and I'm a faculty physician here at the Family Medicine Residency. I've been here for about 10 years now. I'm also the director for the Refugee and Immigrant Clinic at the Family Medicine Center, and wanted to tell a story about one of the patients we had that really seems to encapsulate a lot of the work we've been able to do with our clinic. So we had a fairly recent family who came as a refugee family. And they had been in the country only for about 2 or 3 months when they first came to our clinic. Usually I have residents who work with me in that clinic, and whatever resident sees the patient becomes their primary care physician, but for whatever reason, we just had a medical student from UNC on a 4th-year elective with me that day. His family was also from Iraq, and he spoke some elementary Arabic. And normally when the learners go in, they spend about 10 or 15 minutes with the patients, and then I'll go in and we'll finish up and do a physical examination and lay out a plan. And the student was actually in the room for about an hour and a half. And when he came back out, he was both exhausted and exhilarated with his time with that family. And it seems that this was really the first chance they'd had to really open up and tell their story to someone who wasn't in a position of authority, who was going to keep them from resettling. And it was a family of 5 who had been a family of 6. And they had just recently lost a child during a bombing from their apartment complex. And the children had also, right before being resettled, had also been, had witnessed the beheading of their uncle. So it's a pretty horrible story, a pretty powerful story to hear, and the student was really affected by this. In a good way. We were able to get them established with one of the residents who became their primary care physician, and about 9 months later, which is the typical what's called the honeymoon phase for refugees after they've been resettled, the father started showing a lot of signs of PTSD, depression, some actual visual hallucinations, and our residents worked really closely with our behavioral health consultants, which we have integrated in our clinic, to get the father, who we'll call Mr. H, on treatment, both psychiatric medications as well as counseling. And over the next 6 months, he really stabilized and really started to do well. And I think what a nice end to that story is about 6 months later, I was seeing another one of my patients who was a young male, also from Iraq, who was really struggling with some of the exact same symptoms. And there's still a really strong stigma in other parts of the world against mental health disorders. And Mr. H actually came in with my patient during one of our visits and said, "I'm really worried about my friend. He needs to be on the same medicines that I was on." I was able to convince my patient that these medicines are helpful and that they could really provide him some effective treatment. And on the way out, I really thanked him and thanked him for all his work, and commented on the fact he was wearing a new leather jacket, and he literally took it off his back and handed it to me and tried to give it to me to say that, thank you for helping me with my family. And so it was someone literally trying to give me the coat off their back, and it really just, it's a nice, those patient interactions are the interactions that really make the practice of medicine worthwhile. I started here as a 4th-year medical student 10 years ago, was here as a resident, chief resident, junior faculty member, and now faculty member. And it's a nice opportunity to hopefully influence students the way that I was influenced when I was a medical student, to continue practicing and seeing underserved patients.